New cases of COVID-19 are surging in several provinces across the country. In Ontario, Premier Doug Ford says the rise of cases there is a cause for concern, but he did stress that there are many steps of action in place to handle the expected second wave.
There are cause for concern for all of us. And let me be crystal clear. Every option is on the table. We will take every step necessary, including further shutdowns. In the second wave of COVID-19, it's a scenario that we have been preparing for all summer long. And today, we're in much better shape. When it comes to testing, we have dozens of companies in Ontario manufacturing PPE. We have invested billions of dollars to expand capacity in our healthcare system. We have not been waiting for things to get worse before we take action. We've been working around the clock for months, getting ready for the second wave. And that's why we return to the House today with clear plans to protect and support Ontario.
For more on this, we're joined now by the CBC's Megan Fitzpatrick. She's live for us at the Ontario Legislature. So Megan, what else did we learn about how the province might respond to rising cases?
Well, the Premier and the Health Minister, Christine Elliott, said that they have been working on what they're calling a fall preparedness plan, Andrew, and they will release it publicly in the coming days. And that really will lay out how they are bracing for a second wave of COVID-19. Christine Elliott said they're preparing for the worst. Hoping for the best, obviously, but this plan will include some strategies about how they'll respond. She warned that a second wave of COVID-19 will be more complex to deal with than the first one, and that's in part because it will coincide with flu season. And the government has indicated they will launch a big campaign encouraging people to get their flu vaccination. Another component of this plan will have to do with hospital capacity. She mentioned how there are more residents from long-term care homes currently in hospital because they were moved there to make room in the long-term care homes to ensure physical distance. So there's more people in the hospitals, and they also want to continue with surgeries that had been canceled last spring. There's a backlog of those, and they want to avoid canceling any more surgeries. So that plan will also include a component about hospital capacity. But really, Andrew, today, a lot of their messaging was about people practicing the public health guidelines. They were saying, we know people are tired, they're getting COVID fatigue, they're relaxing a little bit, not wearing their masks as much, perhaps not washing their hands as much as they were before. And they said, really, people have to start following these guidelines again if they have relaxed on them. A lot of the new cases are being tied to social gatherings, private social gatherings, get-togethers of people at homes, for example, not necessarily all at bars and restaurants and that kind of thing. And Premier Doug Ford did hint that there could be more to come on the rules around social gatherings later this week. They talked about how if they do have to impose restrictions again, it would likely be a regional approach, Andrew, targeted at the regions where we're seeing a lot of the cases. That includes Toronto, Peel, and Ottawa.
And speaking of Toronto, the mayor, John Tory, gave his update. What did he have to say about today's figures?
He said they're deeply concerning. That was how he described it, about 112 cases here in Toronto today. And he and the Chief Medical Officer, Dr. Eileen Davila, really were pleading. They used that word, that they are pleading with Torontonians to follow the public health guidelines. They said fighting this really comes down to common sense and compliance. So John Tory was saying, you know, if you go out to a bar to have a drink and you see that maybe the tables aren't 6 feet apart or people aren't staying in their seats as they are required to do by the regulations, don't go in there. Or if you're at a private social gathering, it starts to get too crowded, people aren't wearing masks, leave. They really were urging people to start following these public health guidelines. There's a lot of concern about this, a potential second wave coming this fall, Andrew.
Megan, thank you. The CBC's Megan Fitzpatrick live in Toronto.